Hello, I am Dr. Reddy, founder, medical director and chief retina surgeon from New Retina Eye Care Institute. Today I will briefly be talking about macular surgeries. By macular surgeries, I mean a vitrectomy followed by the retinal manipulations to treat all vitreomacular interface disorders like macular hole, epiretinal membrane, vitreomacular traction and submacular hemorrhage. I will briefly explain what macula is and what vitreomacular interface disorders are. This is retina at the back of the eye. The central area where light focuses is called macula. Macula is the most sensitive part of the retina, and it's very important for all the reading vision and near vision and color vision and contrast sensitivity. So in effect, that is the most important area of the retina for visual acuity. And so all diseases that involve the macula cause decrease in vision. So brief about vitreomacular interface disorders. There is vitreous gel inside the eye. Vitreous is densely adhered at some places like optic nerve, macula and the retinal periphery. With age, when there is vitreous liquefaction, sometimes vitreous gel pulls this macula abnormally, the central macula abnormally, and that results in traction on the macular edema as well as formation of macular hole. Sometimes there is a membrane developing on the surface of the macula, that's called epiretinal membrane. Typically in these patients, rest of the retina is very good. It's only with the central area that they have a problem in terms of macular hole, epiretinal. Now these three entities, macular hole, epiretinal membrane, they are treatable with surgeries. As this is the most important neural tissue of the body, surgeries on this macular area are extremely demanding, and in terms of precision and dexterity. We at New Retina are proud to say that we have a closure rate of 100% in all macular holes, which is a global standard these days. The visual recovery following this surgery for macular hole depends on the duration of the macular hole as well as the size of the macular hole, and in case of membranes, the integrity of the retinal layers that are seen on OCT. OCT is the most frequently ordered investigations in these disorders, and it gives the fair indication of amount of damage to the underlying photoreceptors, and we can also gauge the amount of visual recovery following surgery for these macular holes. Surgery for a macular hole involves removing all the vitreous gel through vitrectomy and doing an internal limiting membrane, that is the innermost acellular layer of the retina, that is also causes some amount of traction to the macular hole, and either filling it completely or stuffing it, and at the end of surgery we put in a SF6 gas. And following the surgery, with some expectations are that patients have a face down position for about 2 to 3 days. This increases the chance of closure of hole. If for any reason patient are unable to lie face down or a prone position, they can lie to their sides, and with equal chances of visual recovery. And as light does not travel through the air initially following macular hole surgery, because for the first 5 days, because eye is completely air filled, patient will not be able to see, and subsequently once the gas absorbs over a period of 5 days, vision recovery will be gradual and gradually increase in over a period of coming weeks. Thank you.